In this video, we will discuss achalasia, a rare disorder of the esophagus. We will cover its causes, symptoms, and how to diagnose and manage it effectively. Let's get started. Achalasia develops from a lack of nerve control in the esophageal muscles. Nitrate medications, like isosorbide dinitrate and nitroglycerin, can relax the muscles and improve swallowing difficulties and chest pain in achalasia. But, their long-term effectiveness and side effects are still debated. They are a valuable treatment option for patients who cannot undergo other procedures. Next topic. Intraoperative esophageal manometry is a valuable tool during surgical myotomy for achalasia. It helps guide the surgeon in achieving an adequate myotomy length and depth, while also identifying additional areas of dysmotility that may require intervention. Pharmacotherapy is important for managing achalasia, especially for patients who can't or won't have invasive procedures. Calcium channel blockers like nifedipine can lower lay pressure and improve symptoms, but side effects can limit their use. Botulinum toxin injections temporarily relax the esophageal muscle, reducing lay pressure and improving swallowing, but the effects only last 6 to 12 months. Patient preferences and potential side effects should be considered when choosing treatment. Esophageal dilation, or balloon dilation, is a common treatment for achalasia. A balloon is inflated in the narrowed area of the esophagus, disrupting the muscle and improving relaxation. It's generally safe and effective, but long-term outcomes can vary, and complications can occur. For patients with persistent symptoms or recurrence after traditional treatments for achalasia, novel endoscopic techniques like peroral endoscopic myotomy, POEM, can provide additional management options. POEM involves creating a tunnel in the esophagus and myotomizing the lay, resulting in improved symptom control. Close follow-up and patient selection are important for optimal outcomes. Laparoscopic surgical myotomy is the preferred method for treating primary achalasia. It offers benefits like shorter hospital stays, less pain, and faster recovery. However, there is a higher risk of postoperative GERD, which can be addressed with additional procedures like fundoplication. Impedance planimetry is an emerging technology that allows for the comprehensive evaluation of esophageal motility disorders, including achalasia. It provides detailed information about esophageal contractility and pressure patterns using multiple impedance sensors placed along the length of the esophagus. This technique allows for the assessment of bolus transit, lay relaxation, and esophageal emptying dynamics. In achalasia, impedance planimetry can help identify specific patterns of dysmotility, such as failed peristalsis and impaired lay relaxation. It can also aid in the differentiation of achalasia subtypes, such as type 1, 2, and 3. Understanding the specific subtype of achalasia may guide treatment decisions and predict response to interventions. Impedance planimetry is considered a valuable adjunctive tool in the diagnosis and management of achalasia, particularly in cases where traditional manometry findings are indeterminate or inconclusive. Let's proceed to the next topic. Helicobacter pylori is a bacterial infection that may cause damage to the nerves in the esophagus, potentially leading to achalasia. However, the evidence is not clear, and more research is needed to understand this association. Eradicating H. pylori does not cure achalasia. Botulinum toxin injections have gained popularity as a non-surgical treatment option for achalasia. However, the long-term effects of repeated botulinum toxin injections on esophageal function are not well established. While botulinum toxin injections provide temporary symptom relief by inducing lay relaxation, studies have shown that repeated injections can lead to a decline in esophageal motility and a subsequent increase in dysphagia. This phenomenon, known as tachyphylaxis, may limit the long-term efficacy of botulinum toxin therapy. Additionally, there is a concern that prolonged use of botulinum toxin injections may lead to an increased risk of developing gastroesophageal reflux disease, GERD. It is crucial to carefully weigh the risks and benefits of botulinum toxin injections and consider other treatment options, such as surgical myotomy or endoscopic interventions, in patients with persistent or recurrent symptoms. Now, let's move on to the next topic. Peroral endoscopic myotomy, POEM, is a newer technique that effectively treats achalasia. This review shows that POEM has high success rates, greater than 90%, and improves symptoms, but comes with more complications compared to traditional treatment. Further research is needed for validation. Achalasia-associated esophagitis can worsen symptoms and complicate management. Proton pump inhibitors and corticosteroids are potential treatments to reduce gastric acid and suppress inflammation. Individualized treatment plans are necessary, and more research is needed on optimal therapy duration. Achalasia can cause deficiencies in iron, vitamin B12, and vitamin D due to problems with food intake and absorption. It is important to diagnose and treat these deficiencies with supplements and dietary changes to prevent complications. In conclusion, Achalasia is a complex motility disorder of the esophagus. This video provided a detailed analysis of various interventions and management options for achalasia, aiming to improve patient outcomes and quality of life. Ongoing research will continue to advance our understanding and treatment of this condition.